Live. Everywhere. On netrootsradio.com. David Waldman. Kagro. In the morning. Now, here's David Waldman.
Hey, good morning, everybody. How you doing? It is Monday, January 10th, 2022. Time for another show, et cetera, et cetera. All right, back to school in a time of COVID once again. Don't know exactly what the situation is back in Loudoun County schools. Like I said, I worry a little bit. I mean, I know the people on the school board are a good bunch, and I know the superintendent seems like a decent guy and has gone through a lot for us. And I just wonder whether they're at the end of their rope in terms of what to do with safely educating as many kids as they have under their charge. Right now, I guess you could point to, well, I don't know. I was going to say you could point to neighboring counties and say, well, things aren't as bad as this county over here, so they're going ahead, so we should go ahead too. But it occurs to us, in a discussion with the production crew last night, at least partially, with the crew inside the house, it seems plain that at this stage of the game, you know, there's varying levels of pandemic fatigue going on at all levels of government and personally, etc., and people who are just tired of dealing with the whole thing. And I think it's been a long time, since the standards that the school systems set out for themselves initially in terms of, okay, well, we will go virtual if there is X% positivity in the community, things like that. It's just out the window now, and they just sort of say, well, we're at 4 times that rate now, and we haven't closed yet, so why close now? And, of course, we've just gone through the terrible election here in Virginia, and everybody was looking at and pointing at Loudoun County, and they feel under, I think, some additional pressure to keep schools open and be positive on COVID, not testing positive. We're trying not to do that. But I think Loudoun County, over the weekend, if I recall correctly, was looking at something in the neighborhood of 400-plus cases identified, anyway, among students, faculty, staff, etc., which, as sizable school districts go, is not a bad record at all. Now, on the map, if you look on the map, a neighboring county would count. You would look at it and you would say, this county counts. Montgomery County, Maryland, lies just across the border with Maryland, and another close-in suburb of D.C., a fairly comparable county. They're larger, and their school system is considerably larger. But just by way of pointing out, for instance, a neighboring county has 10,000 students, staff, and faculty out with COVID. And I think these are COVID positives, and they have another, 13,000, like maybe in quarantine or whatever the hell. What was the story? I found it, actually. You gave it to me. I've got it in pocket, and we can read through it now. The good news is the border between us is a river, and there are very few bridges across it. So there's not a great deal of mixing going on between, well, certainly not the students in Montgomery County and Loudoun County, but we are next to one another, and it is possible to cross. And lots of parents who are at home with kids in Loudoun go to work with the parents of students who are in school in Montgomery and vice versa. And, well, you know how this whole pandemic thing goes. So I'm a little worried about that. And I just read an interesting thread of parents just talking among themselves about their various experiences all over the country with their students who are of age to become aware of this thing and the decision-making process that goes into it. And kids are having a difficult time trusting that their teachers and administrators are doing the right thing by them. They are beginning to believe maybe they're right about this, being forced into doing the wrong thing for political reasons, and everyone's health may suffer as a result. I guess by way of example, Our high schooler is on his way, or probably there by now, I hope, if the bus is running okay, and got his KN95 mask, and fingers crossed that everyone around him does as well, and that the kids who have symptoms are staying home, and that everybody is as healthy as they can be under the circumstances. Whereas College Boy had gotten notice in the middle of last week that they're going to virtual classes for the first 2 weeks. So today's the first day of classes at school, but it's virtual, and he's here and, has locked himself up in the room and boarded the doors closed and is just hoping that high schooler doesn't bring him COVID that he then carries back to college campus when they give up the ghost and go back to regular classes in 2 weeks, if that's the case. But it's difficult for our high schooler to have confidence putting on the mask and heading out the door when he knows that state school has said no to classes for the first 2 weeks, and it's difficult to explain that. But anyway, there's lots of other things to explain. Greg Dworkin will be here to help explain them, I hope, because I forgot to test Skype this morning. Skype works 99 times out of 100, maybe 999 times out of 1,000. I test it every day, but instead I obsessed over what was going on in school and missed the test. So hopefully everything rings as planned, but we'll get to that in just a moment. Oh, I forgot to tell you what Bill had to say for you this morning. The Kagro in the Morning radio show is live now. That's what you've been listening to the past 7 minutes or so, in case you've been confused by it. Having just realized that today is National Houseplant Day, and literally I just realized that as I was reading this because I had no idea. Is that really true? Well, realizing that this is the case, yes, I'll find out now. Yeah, okay, well, I'll find out. It's National Houseplant Day is what I'm being told by Bill's tweet. And it says here that having found that out, I now throw out my pre-planned agenda, that's certainly going to happen, to reflect on how QAnon was started by a single ficus plant with evil intentions. That could be true. That QAnon plant recently elected to Congress to represent Northwest Georgia somehow, Marjorie Taylor Greene, and that's...
You mean all the effectiveness of a potted plant in terms of legislation.
Right, and that's their idea of funny code, is naming the plant that put on the human suit green. Like, wink, wink, all of us plants will know that's code.
Oh, I get it.
I don't know. No, I just made that up myself. So, I don't know. There's a lot of code talking going on. That was a subject of discussion this morning, too, as I try to figure out what teachers are assigning to my son. All the work has pronouns now, not just the people. There's no longer quizzes and tests. There's major summatives and minor summatives, and I haven't got the glossary yet. I mean, I do, but I think it's stupid, and I resist the glossary. It's very difficult to figure out what teachers are talking about teaching kids these days, but that's because I'm old.
Yeah, well, the glossary says things like, this particular set of words, which may not mean anything to you, actually is code for, please turn your back and don't face me directly and spew virus in my direction.
I think they do have that code now. It's a hell of a thing to figure out what's going on, and that much harder to do when they don't want you to know.
Well, you've heard the saying, the darkest hour is just before the dawn.
I have heard that. It makes no sense, but people do say it. Yes.
Or, just when you think things can't get worse, they do. One or the other.
Yeah, I usually sit there and say, I feel like it was darker even an hour ago, and it is before the dawn. But I get the sentiment, but I certainly felt darker about 2 hours ago. But they say it's not.
So the headline in the Pundit Roundup today is a milder but more infectious Omicron is still bad news.
Oh, yeah, well, right.
And that's basically what's going on here. It's interesting because the wave is so overwhelming that it actually may be running ahead of the models. A lot of the modeling for it, for example, has New York City peaking next week. Celine Gounder, when we talk about her tweet storm, mentions that. But the data suggests might even be this week, might even be now.
Oh.
So there's some data available from the New York State Department of Health that suggests that, maybe hospitalizations have evened out in New York City.
Oh,
and maybe the number of cases has evened out because the percentage positive, that is to say, if you take a case, if you take a test, what percentage of them are going to turn out to be positive, is starting to drop for the first time in all 5 boroughs
Yes.
since
It's
this
dropping
wave started.
to 98. Yeah. Great. All right. Well,
Well,
okay.
it was above 20%, and now it's below, which is
Hmm.
good. So the other thing that's pretty evident, and this is important when looking at New York State as a whole, is the New York City data on hospitalizations per 100,000 people based on whether or not you're vaccinated. I think that's the first chart I sent you. If you're vaccinated,
yes,
you have a not very good chance of winding up in the hospital. And if you're unvaccinated, that's like 60% more likely. It's just amazing, the differences between the vaxxed and the unvaxxed.
Yep.
And the chart that I have at the top of the pundit roundup happens to be from December 18th. So you can say, okay, well, it's old. What about new data? Well, the new data shows that even more so.
Oh.
And that's the very last chart that I sent you, second to last chart, which is vaccinations.
Okay.
And the last chart is New York City deaths. And so you're just much less likely to die. I mean, it's like it doesn't have any effect, this wave, on the vaccinated, according to the data.
Death-wise, yes. Good.
But
I mean,
if you're
I'm
unvaccinated, the chances of dying have like quadrupled.
Yeah, I don't know why that doesn't ring a bell with people, but people are still working on trying to make it.
The thing you have to remember is New York City is much better vaccinated than the state as a whole. So when you look at the state as a whole,
the state as a whole, by the way, yes.
Well, especially I'm a New Yorker, New York City,
there you
New Yorker. So comments about upstate I'll skip for now.
Okay.
Unless we're talking about Troy.
Oh, all right. I mean,
Troy's a whole, but I wouldn't say that
it.
about that upstate New York, which is absolutely gorgeous.
We love you. You're fantastic.
We love you. You're wonderful.
They even make
but you need to get vaccinated because upstate New York isn't nearly as vaccinated, and so places like Albany Medical Center, a hub, for example, for parts of upstate New York, are very, very much under stress in terms of their beds and such. So a lot of good data coming out from New York. Yes, they separate COVID with versus COVID from, something of an artificial designation, but people are into it these days. There's a number of reasons for that. For those who want to take hope, or for those who want to malign the whole thing altogether, you can look and say, oh, well, half of those aren't even COVID. They're just like broken arms with COVID. But as we've talked on the show all last week, that's not exactly true. If you have diabetes, for example, and you have your sugars rise to the point where you need hospitalization and you got COVID, you're admitted for diabetes, but it was the COVID that threw you over the edge.
Right. Everybody's got COVID. What else you got for me? Oh, diabetes, you're in.
Yeah,
it's like
it's the diabetes that put you in, and so that's your admitting diagnosis.
Right.
DKA or hyperglycemia, or whatever it is that you have issues with. But the fact that COVID put you there not only says that COVID isn't a good thing to have in this particular time frame, particularly if you have underlying conditions.
Yes.
But it also potentially infects other people in the hospital, makes the staff get sick, and so that they have issues coming in. And the work that you need to do, as well as the equipment you need to do to keep the isolated COVID patient away from everybody else, is also a big deal.
Yeah.
So all of this is stress on hospital, and nothing about it is good. Now, half the patients being admitted from COVID.
All right.
Nobody argues that. Okay. But
I'm not arguing that with you.
The part about that is that if only half the patients are admitted, but you have a gazillion patients admitted, half a gazillion is still like a really big number.
Right. Sure. Huge. That's problematic, and all of them breathing, and you want to keep them breathing, which is amazing. What a contradiction! But every breath does.
I have this cartoon that I have in the pundit roundup.
Breathe in a bag,
which kind of sums that up. Let's see if I could find that and send it to you. I have the
pundit roundup open. I can find it. How many cartoons you got?
Well, it's a guy in a bed.
I see it
in a hospital bed.
Yes.
And he yells out, "Nurse!" And the person in the next bed says, "Yes."
That's pretty good.
That kind of sums it up.
Mass death. Well, it's the lighter side of global pandemic, but it's true. It's funny because it's true. Yeah, sure. I'm into it. I understand it. Okay. Yeah, that illustration style seems familiar. I feel like I've seen this guy's work before.
Yeah, Galgen humor, I think it's called in German.
Oh, okay.
So speaking of Galgan humor, here's one of my favorites. This is neoliberal Jon Snow tweeting. Jon Snow, you may recall, was the fellow in England who said, cholera is probably from the water, so why don't I remove the handle on Broad Street and stop the cholera infection and sort of, prove my point because nobody believes me.
No.
Right? That was Jon Snow, very famous in terms of epidemiology. So neoliberal Jon Snow tweets, Broad Street businesses were complaining, so I reinstalled the pump handle.
I don't even know why that's funny, except now you told me the story.
Except it's funny.
Oh, yeah, right.
Right? So what's the point of all of that?
Well,
let's take that in context with this remarkable piece from a fellow, who I think actually is a fellow somewhere. I think he's a fellow at Harvard, named Justin Feldman.
All right, Justin Feldman. What do you have to say for yourself?
Just-in-time Justin Feldman is writing about a year in, how has Biden done on the pandemic response?
Oh, well, I don't know.
Okay. The market approved of the last message. Keep calm and carry on. All likely will be fine. And on December 27, 2021, in a bid to keep businesses open amid the mass infection event, the CDC abruptly changed its guidance on quarantine and isolation.
Yeah.
Most controversially, the agency suggested that workers should stay home for only 5 days, but then mask for 5 days, down from 10 days previously, even as many could still be contagious to their coworkers. There'd be no need to test or even wear a more effective N95 mask, because CDC guidance states returning workers should wear a mask, but generally recommends less effective cloth masks. And federal officials, including Tony Fauci and CDC Director Rochelle Walensky, have repeatedly told the press the move was, at least in part, meant to keep commerce moving unobstructed.
Yeah, right. No.
So how did we get in a situation where a Democratic president who ran in part against Trump's horrid pandemic response is letting the virus rip? How did we get to a point where a key organizer of the Great Barrington Declaration, a right-wing libertarian campaign opposed to public health, has stated Republican and Democratic states alike have adopted policies in line with their philosophy? This while hospitals fill up around the country. And as hospitals fill up, why are political leaders doing nothing at least to try to flatten the curve? Remember that?
Yes. Didn't seem to catch on. But yeah, I already remember it.
Well, the Biden administration, he argues, Justin Feldman, I argue, made a strategic decision to prepare for one specific pandemic scenario. And that scenario, high levels of disease and death would continue in early 2021, followed by widespread population immunity from both vaccination and prior infection.
All right. So that was the hopeful scenario that we...
population immunity would lower the death toll to manageable. And in this scenario, the Biden administration's pandemic response would focus on vaccination and medical treatment and reject other public health measures, so-called non-pharmaceutical intervention. In other words, masks and ventilation.
Yes, which is what we were trying to do,
and mandates.
Waiting for the vaccine. And then we got the vaccine, and
then they said, okay, you don't have to do that stuff anymore.
Yeah.
Biden's gamble made sense on a political level because a more comprehensive public health response would have required new laws and regulations, many of which are costly to business owners and run the risk of energizing the far-right Republican base. Some of these measures would require support from the Senate's slim and unreliable Democratic majority, and also ran the risk of displacing Biden's Build Back Better agenda. And he doesn't mention here, but should have, that also whatever Biden did, like through OSHA, would have been rejected by the Supreme Court.
Yeah, well, right. It seems that way.
So it's nice to say you could have, should have done these things, but actually you probably couldn't do those things. So let's just remind everybody of that. In the end, it's like blaming Manchin and Sinema for everything, but forgetting about the 50 Republicans who are the reason why Manchin and Sinema get to decide.
Yeah, although I would like to have seen some effort.
Okay. Yeah, well, that's the thing. That's exactly right. I mean, the whole point of this piece here is there's a difference between I tried and I couldn't get it done and no effort made. That's exactly right.
It probably wasn't going to work. I feel like I have a kid.
Well, if you're a politician, your job is to try to determine that in advance, just like if you're a modeler for the vaccine or you're a modeler for the virus, you're trying to figure out what's going to happen next. So, that's not unreasonable. That's what politicians do. and you want them to, and you want them to be right. But sometimes you don't want them to be right if what they're doing is what you don't want them to do. Biden advisors chose a narrow path of pharmaceutical intervention because they saw the politics of a comprehensive public health response as losing. The White House didn't want a pandemic to define Biden's presidency. The virus, however, had other plans.
Dang.
Okay, rather than pursue public health measures that impede commerce, the Biden administration promised to speed up vaccination while supporting masking and mask mandates, protecting workers through OSHA and expanding testing availability. They would deploy a new federal public health service corps of 100,000 workers to help with tasks like contact tracing and vaccination. Nobody does contact tracing. You can't. There's too many people. Biden's campaign message went, I'm not going to shut down the economy. I'm going to shut down the virus. Yeah. In other words, they were going for they didn't say it, but they were going toward a let's have a close to zero COVID policy. Yeah, and that was before he assumed office.
All right, so a totally different situation. Although it was hard to believe then because there was a tremendous peak going on. But okay.
But once he got into office,
then there was
the administration's focus was almost exclusively on speeding the pace of vaccine distribution.
That was sensible, and I think everybody would have tried that. I mean,
in Republican-dominated states, many of which had implemented restrictions for at least several weeks in the spring of 2020, these policies had become untenable for various reasons. On top of pressure by business interests, the far-right electoral base that can make or break governors and primaries had come to reject public health measures.
Well, that's stupid, but
that's what happens. Yeah. You see, Greg Abbott and Ron DeSantis, for example.
Yes,
right. And they're not just stupid because they're stupid directing their base to do this or that. Their base is directing them. So let's be clear about that.
Well, okay, then tear their base to pieces instead.
In Democrat-dominated states, the rationale was more likely a simple economic calculation. The assistance programs to businesses and unemployed workers that made restrictions on business palatable had run out. Many public health measures had therefore become far more expensive. When I counted in early January 2021, only 4 states in the entire U.S. had fully closed indoor dining. And even then Governor Andrew Cuomo said, we can't stay closed until the vaccine hits critical mass. The cost is too high. We will have nothing left to open.
All right.
All right. So in February and March of 2021, Biden went to Congress with his proposed spending bill dubbed the American Rescue Plan. The bill was mainly aimed at giving people money, more stimulus, the return of pandemic unemployment boost, largely unrestricted funding for state and local governments. Notably, there were few carrots or sticks in the bill designed to promote the adoption of public health. There was little funding to businesses through the Paycheck Protection Program. That made it difficult to close or restrict businesses because it wouldn't be sufficiently subsidized. COVID testing in schools would cost $8.5 billion a month, and the America Rescue Plan allocated $10 billion total one time for school testing.
Yes. Right,
but wasn't contingent on adopting particular public health policies. No occupational health regulations. No paid sick day requirements for employers. And the American Rescue Plan passed on a party line vote, meaning it didn't need 60 votes because it was a spending bill. So you could argue that the bill couldn't get any other stuff in there because it was a spending bill. But at the same time, there was no visible attempt by the Biden administration to improve the bill from a pandemic response. And we know what failed efforts look like. Senators complain, Manchin and Sinema complain, the Senate parliamentarian says you can't do it, statutes are blocked by the courts, all the stuff we're seeing now. Okay, but we didn't see any of that. So they didn't try. So that's why your point about I'd like to see him try is exactly right.
Oh, well, okay. I was thinking of some other stuff, but it seems to me like that. I thought we did try, and the answer was no, and you're going to do it under reconciliation. You can't do this, you can't do that, and I'm Joe Manchin, and I want everything slashed.
So slashing isn't supporting. Right. The marked policy shift came in mid-May 2021, a few weeks after all adults were eligible for vaccination. The move that received the most attention was the revision of CDC guidance, no longer suggesting fully vaccinated people wear masks in indoor public places.
Yes, that I remember.
The second shift, which received virtually, and in retrospect looks awful.
Yeah,
the second shift, which received virtually no media attention, was the White House's decision to abandon OSHA regulation that would have protected most workers nationally. The agency had proposed requirements for masking, testing, and paid quarantine and isolation, but business groups objected. Instead, the administration went forward with a narrower rule restricted to healthcare workers. And then finally, in mid-May 2021, a shift in language, personal responsibility, and individual choice. Your health is in your hands. It no longer is a public health thing. Now it's an individual thing.
Okay.
Here's the problem with that, by the way.
Yes.
So leaving from the article, which goes on to, it's a very long article, and we'll continue it after the break. I think it's important because it characterizes a lot of stuff that went wrong. But this whole shift into individual responsibility, which is really a Republican sort of thing,
yes,
illustrates the whole problem in New York City, for example, and New York State with COVID. Because COVID, for an individual, especially if you're vaccinated, is a milder threat than Delta was.
Okay.
But to the public health system, to the medical system, it's as big or bigger a threat. And those two things can be true at the same time.
Mm-hmm, of course.
So if you've been vaccinated, the chance of you winding up in the hospital is pretty small. So to you, it's much less of a threat.
Yeah, screw it.
To the hospital, there's so many people that are unvaccinated that they're getting overwhelmed with numbers.
Yeah.
So that's bad. And if they say that's bad, you say, but I'm good.
Yeah.
And Republicans say that's exactly what we want. So to hell with you. We're not doing this for public health reasons. There are more voters than there are hospitals. So we're going with the voters here.
Okay. Hospitals don't vote,
That's
man.
exactly the opposite of what public health is supposed to be. And that's really the point of this guy writing this article.
Well, that's a great point. Shut up, old man. Go back to the laboratory, you nerd. I guess is the Republican response.
He's a young
to
man,
that.
actually.
No, shut up, you young man. You don't know what you're talking about. You're not old like us. Go back to the laboratory and do the graduate work. I don't know.
Health and Human Rights Fellow at the Harvard XP Center. See, I told you he was a fellow.
Sure. Harvard. Hi, it's me, David Waldman, the same guy who was just talking to you a second ago. Our Patreon subscription drive is still going strong, with over 175 monthly donors who help keep us on the air. If we've helped keep you going during the pandemic, why not return the favor and help us keep going so we can all be together for the next disaster? Patreon.com, Patreon.com, makes it easy to make secure, recurring monthly contributions to support our show. Patreon.com/KagroX gets you straight to our donation page. Maybe you'd like to thank us for keeping you sane during the Trump era. Maybe you're looking forward to in-depth explanations of what's going on in the Biden administration. Whatever it is that keeps you listening, we need your help to keep bringing it to you. And hey, if you happen to prefer using PayPal or even the Square Cash app, we're up and running with those options too. Thanks again, everyone, for all your support. We literally could not do this without you. All right, welcome back now to the Kagro in the Morning Show here on Netroots Radio. We continue with Greg Dworkin. We were in the middle of a long article from a fellow. He's still here.
A fellow at Harvard FXB Center, Health and Human Rights Fellow Justin Feldman.
FXB.
And remains interesting. He makes a very interesting point about the unvaccinated. Who remained unvaccinated by late 2021? While the media often highlights the notable partisan divide in vaccination rates, which is true because Trumpers are less likely to get vaccinated, it's also notable that half of unvaccinated adults didn't vote for Trump. In fact, many didn't vote at all.
Oh, okay. Well,
we have that problem.
That's voting for Trump at this point. Okay.
The unvaccinated are largely low-income, uninsured, pregnant, incarcerated, and children.
Still.
While vaccination rates are high for people ages 65 and up, those in their late 70s and older have lower vaccination rates than younger seniors, suggesting a lack of autonomy, that is to say, needing to rely on others to access health care, if you're in a nursing home, for example. And while racial gaps in vaccination rates have narrowed considerably, huge inequalities in COVID death rates remain. By my own calculations, age-adjusted COVID mortality between August 1st and December 4th, 2021, were 30% higher for Black and Latino, 100% higher for Asian, American Indians and Alaska Natives, and 340% higher for Pacific Islanders compared to non-Hispanic whites. That's what he does for a living. So those are his calculations. And that's why when people say, well, you're not vaccinated, it's your own fault and it's a pandemic of the unvaccinated. The unvaccinated aren't all, Trump voters who refuse.
All right, that's
There's
a
a lot
point.
of people who fall in these other categories, half of them.
I had the idea in mind that that had changed of late, but I guess it's
Not
not
enough.
So. Okay. Just a little bit. And, and maybe it's just...
It varies where you are. Perhaps
sure.
New York City's done a better job because a lot of people are vaccinated in New York City.
Yeah. I wonder if it's the fault of, not the fault of, but I wonder if it's exacerbates the problems that, what makes it for interesting copy, whether for mainstream news outlets or online social media type outlets, is the stories of the people who are or were Trump voters.
Be back
who
in a moment.
Get sick and die from COVID, and everybody points and says, "Look how dumb they're being." And I guess it just doesn't make decent copy, and I can see why it wouldn't if it's just this person was just essentially a political dropout, or was for that matter interested and involved, but not a rabid Trump fan or whatever. But the unvaccinated stories that we keep hearing are, I don't know, the ones that get amplification. Perhaps that's a social media fault. Seem to be the ones about the Trump supporters who've been daring COVID to come get them the whole time, and then it did, and that makes an interesting story, and it might not be reflective of reality. That's easy enough to understand. I think you can all figure that one out. Okay, well, let's see. Oh, Greg's got an extended break going on, so we'll wait for him to return.
We're back.
No, say I don't even have to wait. Okay, great.
Had some plumbing issues. And,
they're working. All right.
Well, the second part of it. So the plumber called during the show because that's the best time to call.
Yeah, right. Oh, I have everybody call.
Right.
During these 2 hours.
Anyway,
yes.
His last point is the Biden administration has exaggerated the proportion of hospitalizations and deaths attributed to the unvaccinated. Fauci claimed in July 2021 that only 1% of COVID deaths were among vaccinated people. It's a lot higher than that.
Okay.
But anyway, going back to the timeline, it's mid-May, and the Biden administration's abandoned OSHA workplace regulation for COVID risk. And Biden's major pandemic economic policy is coming under attack. And Republican governors in what ultimately would be 26 states ended their participation in the pandemic unemployment programs. There were multiple options that Biden administration could have pursued to keep the benefits going, but they didn't make an attempt. And I think the most plausible explanation is that, as argued by the authors of this comprehensive Bloomberg law analysis, a war with GOP governors would carry significant political risk for the administration as it tries to sell more than $2 trillion in infrastructure spending and massive family-focused legislative package. So they basically picked infrastructure and Build Back Better over public health measures. And they've made that decision and said, you know what we're going to do for public health and for the pandemic vaccines. And basically the problem with that is that people are still refusing to get vaccinated, like in places like upstate New York.
Yeah, they can do that.
And then Omicron hits, and the White House couldn't make swift action to make antigen tests widely available because its prior policy stances were to not support that.
Well, that's bad. Yes.
Right? So the White House's approaches to masks has many parallels with its relationship to rapid testing. The administration's failure to make N95 masks widely available or even promote them, and their framing of masking as an individual choice rather than a component of public health is the problem. Okay, we know N95s, KF94s, KN95s, all of those do a better job of blocking transmission.
Yes,
but as with rapid tests, merely providing individuals with tools isn't a public health strategy. Not if you don't make sure that everybody has them, not if you don't make sure that they're required. And so that's basically why we are where we are. And I think it's a pretty comprehensive and fair assessment. And he ends.
Yes, I'd say so, overall.
The loudest voices in civil society have largely supported Biden's approach to the pandemic or pushed him to reject non-pharmaceutical interventions. This select group of media pundits, public health scientists, and economists have been in direct dialogue with the White House. The administration has cited their opinion pieces and promoted these views. Right? Just look at the Twitter timeline of Ron Klain, for example. And those of us who see ourselves as concerned scientists or leftists or otherwise imagine ourselves to be part of an engaged civil society should learn from the failure to respond to a crisis, particularly since we don't know how long this one will last in a 4-degree warmer planet.
Oh,
what's coming next.
I didn't realize that was getting thrown in there.
That's how he ends.
Sure. All right. Well, good. That's like one of those cliffhangers for the next episode. Right? You can write on that now. Oh, yes, that's right. Another problem developing. Oh, I hadn't thought of. Lots of you out there were thinking of nothing else, but for me it was new. So we could look forward to another installment, perhaps. But, yeah, the only thing I think that he leaves out of the calculus, and it doesn't change the validity of the point either, because we didn't get to see very much of it. But I do think that there was a lot of temperature taking probably going on, but behind the scenes, as between the White House and the congressional liaisons and those on the Hill. What would you think of? How could we have your support for a package that includes extended payment of more benefits? What? No, we've been doing that for a year. People, hang me for that. Let's focus on the infrastructure bill, and okay, maybe also that other one.
We're fond of calling them message bills. We know they're not going to pass, but you pass them in the House and then they fail in the Senate, and then you could say, see. Right. And why do they pass in the House? Even that's tough, but Nancy Pelosi, so you could probably get it done regardless. Mm-hmm. And in the Senate, that's not even close to being true.
Right. So I think we missed a lot of what was going on behind the scenes, but from what was visible, that seems like a pretty good summation of what happened. And, of course, it was a call for more of it to be visible, which, okay, that seems legit. Why not?
Well, we always say that. Even in public health, if you're doing stuff, be transparent about it. If you change your mask message, say why. Well, that would require saying, well, we're not getting support from Republican governors, and they're not going to do it, and the public isn't going to do it. So we have to do something that they will do, which, by the way, makes a whole lot of sense. At least at some level. It's interesting that some of the best-known pandemic modelers have actually taken a look at CDC's guidelines about 5 days of isolation and then wear a mask. Mm-hmm. And they say, based on their models, it actually works okay.
Oh, well, all right. That's good news. I was afraid that was going to be the opposite, but we were going to do it anyway. But all right, if it works, it works. Or
so it's not totally terribly crazy. It could be better. And that's the thing.
Yeah. Oh, well.
If you step back and look and see, well, how is the U.S. done with the pandemic relative to other countries? And the answer, for the most part, is worse.
Well, yeah.
But that worse seems to be, so far, at an acceptable political level. So if you handle Omicron and make it no worse than Delta, that's bad from a public health perspective and probably acceptable from a political perspective, which is horrible.
So. Well, when one side is dedicated to having as much infection as possible, well, I guess that there you go. There's the compromise. One side would like not to have any infection, and the other side wants as much as possible. Why don't we split the difference?
So we split the difference, and we have an only average approach.
Yeah,
and that's okay.
With one of the largest populations in the world, and that'll give us fits for a long time.
Right. So Clive Thompson tweets, here's how we beat COVID, people. New York Daily News headline. Vaccine appointments multiply after Quebec requires shots for weed and alcohol stores.
Yes, the Canadians, or at least the Quebecois, have figured it out.
David Wallace Wells writing in the New Yorker, America's Omicron wave already looks more severe than Europe's. And this is an important point that Celine Gounder makes in a tweet riffing on that. America's Omicron wave already looks more severe than Europe, says David Wallace Wells. I guess you read the article.
Right, but you said that first.
Right. Omicron may not be as benign in the U.S., and the American context may be different. Okay? Delta was much more lethal in the U.S. and in Europe. The higher rate of severity observed so far is a reminder that the shape of a pandemic is not simply a matter of the biological properties of the virus. It's also determined by the social and immunological context in which that virus spreads. What does that mean? New York City versus New York State.
Okay.
New York City has a lot of people.
Vaccinated bodies.
So when Omicron hits, a lot of people wind up in the hospital. But relatively speaking, there's some decoupling, the favorite word people like to use, between the number of cases and the number of people being admitted to the hospital, and certainly to the ICU. That's not seen upstate, but that's because upstate isn't nearly as well vaccinated. So that's what they mean when they say the social and immunological context in which the virus spreads. Yeah. If you introduce it upstate, they're going to get hit really hard. If you introduce it to one of those counties in North Dakota that's only 11% vaccinated, they're going to be devastated.
Yes, if there's anyone left in it from the first time.
But if you do it in New York City, where most people have at least one shot, then it's going to be tough, but you can get through it. Okay. And so that's what we're seeing here.
Yeah.
Okay. Well, and so, again, that may be true, but even though there's less, association between the number of cases, thereby predicting the number of hospitalizations, it's not as dramatic as it could be. Certainly if you're looking at New York State as a whole. Mm-hmm. And the whole idea of decoupling is like mild, okay? Milder doesn't mean mild, you don't have to worry about it. If you're vaccinated as an individual, yes, but as a public health system, no, you still have to worry. Decoupling doesn't mean, now there aren't going to be any hospitalizations. If people thought that's what it meant, no. And so, people are trying to use decoupling and mild as a way of saying, you see, we don't have to pay attention to this virus anymore. It's not just the Biden administration that's doing that. People do that. Governors love to do that.
Yeah.
It's not true. That's not what decoupling means. In this context, decoupling means that the rate isn't going up as fast as the cases. The rate of hospitalization and death isn't going up as fast as the cases. That's what decoupling means. Decoupling doesn't mean so it's not going up at all.
That is correct. You can see it in my nightly numbers, or now daily numbers. That's the other trend. I've had to update numbers during the day a lot these days. And that was something that's been missing for the last couple of months. It was something you could wait to the end of the day for and add 100,000 new cases and 1,000 new deaths, but only once at the end of the day. I have to do it multiple times during the day because we're registering 1 million cases, but we're also finding it used to be the case for the past couple of months. Every 100,000 cases I added to the total, I'd eventually, very soon thereafter, add about 1,000 deaths. In other words, the 1% that we've been talking about the whole time. But lately, adding 1 million cases a day, you should be seeing 10,000 deaths, but you're not. You're still seeing the same 1,000.
Especially in Florida, because they don't count them.
Yeah, well, then there's that.
Only 3 people have died in Florida during the entire pandemic, if you believe them.
I know, right. And all of them were guilty of voter fraud, too.
They were all Democrats. And they all probably, were from New York.
So. But anyway, I have noticed.
And they all lived in Boca,
sure.
And they all voted for.
They live in the villages, apparently.
Yeah.
Okay. Well, they should vaccinate everybody. Up in Quebec, they say you can't get your liquor or weed without, at the official stores anyway, without vaccine. I think they have vaccine passport to get into it, which is even a step beyond what we're doing. But maybe we need to do it at the golf cart.
Well, I have to say, though, it is okay to step back and look and think about the big picture and whether or not the things that you thought were good ideas then are good ideas now. If you get vaccinated and vaccination doesn't protect you completely from getting infected, which it doesn't,
right?
And Omicron is that virulent, and therefore if you're vaccinated you can have an asymptomatic case, having a vaccine passport doesn't make the same sense as it used to.
Yes, that is true.
Right? Skip the passport and go with the mask requirement. Make that adjustment. Oh, well, but you said, you're adjusting because of the data.
Yeah. And if you do it the way the Quebecois did, then you could say, no, we didn't change anything. You're high. You don't know what you're talking about. Oh, yeah, that's probably true.
So Celine Gounder says, this is the point I made over and over. The simple math I give is even if it's half as virulent, half as deadly, your case fatality rate is reduced by half. If you have twice as many cases, you got the same number of deaths.
That's right. And if you're dying, you say, well, this was a lot less likely.
The way other concerned doctors and epidemiologists have put it is, you're going to recognize this one. A small fraction of a huge number is still a large number.
Yeah.
I've heard that before.
Right.
I think people have fixated on this idea. It's mild, Gounder says. That's why I'm highlighting this, because it's true. Mild means mild, relatively mild for the individual. It doesn't necessarily mean mild at a population level in terms of numbers of deaths. If a lot of people get infected, even if it's a relatively benign virus, enough of the people will still have to be hospitalized. They'll still die. It's going to be overwhelming for the healthcare system, and it's going to be really tragic. And again, mild and milder aren't even the same thing. If you're unvaccinated, I'm not sure it's even mild.
Right,
but I know these
true.
3 people who got sick and they didn't get that sick. Great. And what about the other 1 million a day?
Yeah, right.
You know them all? You're going to take comfort in the fact that the one that you know or perhaps don't know but are lying about on Twitter, because who knows?
Right.
Because you only have 35 followers and you're trying to make the point that this is just a cold. Even if those cases are true, it has nothing to do with like what's true for the population. That's why population public health is so important, and you can't just go by individuals. So this whole individualistic, rugged individualism of the United States is going to set COVID policy. Mm-hmm. That's a plague of a different kind.
It is. Not to mention the fake rugged individualism that ends in a GoFundMe appeal. But
right.
Well, yeah, mild. That was a terrible word to let loose into the vocabulary. What can you do? It's the wrong word for it. It kills at a lower rate, but more people get it, and so we end up getting killed at pretty much the same rate. And that's bad, and you didn't like it when it was happening before, and you're not going to like it now.
Right.
But
the other thing that's
no
different
sense
from the U.S. compared to other places, and there's no questions vaccines are helping. We're just not as vaccinated as we should be.
True.
And so the Biden administration was right to push that part, but they need to push that even harder. That's where mandates come in my view.
Yeah.
So the U.S. began the Omicron wave at close to 50% of its previous peak, according to the New York Times. And so that being the case, we didn't start from zero the way South Africa did. We already had a Delta, we haven't finished with it, thing going on. And that made extra Omicron hospitalizations that much more difficult, as well as difficult in terms of teasing out who was there with, who was there from, what does it all mean. What it means is that there aren't enough beds for the people who need it. That's all you need to know. The focus on with and from is not as helpful as you think.
Not at all.
People hone in on that the way they hone in on decoupling, the way they hone in on mild, because they want to prove to themselves or to you, whether they're paid to or not, that this isn't anything and we shouldn't be doing anything about it.
Yes. He's only mildly dead.
And therefore, if that's true, what you really need to do is blame the Democrats for getting in the way of being normal. That's the purpose of all of this.
Well, I knew they would come around to it eventually. Okay, well, naturally all our fault because you want people to stop dying from things and they don't want to do it. And I don't know, maybe at some point, maybe this is the way they eventually win the let her rip strategy. Is you say, well, at some and we've gotten close to that in the public health planning. Like if you get yourself vaccinated up and get your booster and wear your mask, yeah, it's true you may still catch an infection, but you'll be around to watch everybody else who insisted that none of those things worked catch it and have a terrible time of it and maybe even die. I mean, if that's worth it to you. But that's a tough pitch to make as a caring people.
Yep. So this is a piece from the University of Florida. Mm-hmm. COVID-19 models updated projections for Omicron wave in Florida as of January 5th.
Yeah.
Okay.
This one
they are projecting that the most likely, the scenario assumes the Omicron variant would have high transmission, moderate immune escape, low disease severity. And with that, they expect it to peak mid-January.
That's almost now.
And that's why looking at New York,
How
peaking almost now, makes sense. I mean, that's basically what the models say. It's just that the Omicron is so infectious, probably even more than the models, that you may even peak a little earlier than the models show.
Could be, although...
And the number of deaths in Florida are projected to be just the same as it was last January.
So, big improvement.
Even though Florida reports 3 deaths a day, that's not really what's going on.
Yeah, there's been a bit of controversy. For a long time, their reporting has been suspect, and I guess they're getting
Well, you don't use the
evidence
Department of Public Health or Department of Health in Florida. You go to the Hospital Association in Florida to find out anything. It's just that the data is sometimes a little delayed.
All right. Yeah, so I've seen there's some articles floating around. Again, another round of this is how Florida is essentially rigging their numbers.
Right. The main finding from this Florida thing, if it's too long, you don't want to read it. The main finding is the Omicron wave is expected to peak earlier than previously reported. Earlier meaning mid-January rather than late January. And we're already at mid-January. It's already the 10th, so they're talking about peaking this week.
So I feel
which
like
is pretty much, I think, what New York is doing. And, of course, New York, Connecticut, and Massachusetts are all connected. In Massachusetts, you could see that, I'm sorry to say, because, not everybody likes to do this. But if you follow the wastewater.
No, I don't like that at all. Stop there. Yeah.
They're looking for COVID in the wastewater.
Right.
And it's already peaked and starting to drop.
Right. Great.
And here's the site that does that, because I know this is like something you're really interested
COVID
in.
with cholera. Yes.
Yeah, but hey, how many were from cholera and how many are with cholera?
Right. Well, I blame you for not wearing your cholera-proof suit when you went into the sewer. It's your fault. Honestly.
So that's a positive sign. The New York State data is a positive sign. And hopefully what it all means is that actually as people, the news is often like a couple of days behind reality here, if not longer.
Sure.
So as the news starts, oh my gosh, look how terrible things, it's actually turning the corner in some places. Which is not a rosy view. It's pretty bad. And so it'll stay bad for a little bit because of the, lag between cases and hospitalizations and such. But we'll probably get through this. We'll probably muddle through this just like we muddled through Delta. And the conversation's going to change. And so, we have to be prepared for all of that. Okay. But in terms of what's the best way to do things, you still need to wear a quality mask. You should get boosted, not just vaccinated. Your full series should be 3. Mm-hmm. We're not talking about 4th boosters at this particular point in time, probably unnecessary. We'll see.
Oh, boy.
And at the same time, you should at least think about how you would get rapid tested or PCR tested if you need it. In New York City, there are stations for that. You stand on line, but you can get it done. Mm-hmm. In Connecticut, they've handed out test kits to each family, so at least each family has a test kit, and they're going to get more. If you want to go on Amazon, the wait time for test kits is about 2 weeks, so plan accordingly. If you're using it for school to get your kids back and forth, maybe you want to stock up. Assume it's going to take 2 weeks for you to get your kit. I mean, but if you want to be individual and take care of that, fine. I think it's better to do it as a public health approach. I think the feds should be working on testing and test kits and sending some to everybody the way our state does. I think they should do the same with masks. I think they dropped the ball on that. And I think they, can't just throw up their hands and say, well, there's nothing we can do.
Yeah, I'll agree with all of that. They probably should have been working on that, and I'm not certain why they decided that it wasn't their responsibility. All right. Well, we'll be looking out for this. I do feel like Florida runs a little bit behind New York in this stuff, but they're connected.
Well, it takes a while to fly down there and back.
Right. Yeah. So that's the lag, 2 hours or so.
Never mind that. What's the wastewater in Boca look like?
Oh, I don't want to know.
Forget Miami. I want to know what it is in Boca.
Right. Well, the prune content is higher anyway. So, yeah, I wouldn't want that job either. And, once again, I think a wave that's affecting one part of the country. We're watching.
Well, we have 50 pandemics.
Yeah, the other part of the country saying we don't have. I'm not seeing that here. It's a city problem, and you've done this like 5 times now. It happened initially at Delta.
Yeah. Okay.
Yeah.
Well,
right.
Look where we are now.
So, it'll be very interesting to watch watching the numbers nightly and mapping out where the hot spots are and where the numbers are running lower has been very interesting. And the states, states like Florida, where they're so invested in pretending that their problem is non-existent, they love to lean on stuff like that. They've for a while, Florida found itself on the list for the places where the daily new reports was lowest, and that was them coming down off of Delta, I think, essentially, while New York was on the way up with Omicron, and it was a matter of days before Florida was right back in the mix as the hottest spot in the country. And then when they see that begin to dive in Oklahoma, Wyoming, Nebraska, etc., they'll be pointing and laughing because now we're on the list of the lowest numbers. And we'll wait 2 weeks and we'll talk to you then. Then, of course, it will be, why did you abandon us to this fate? Well, it was really you. But I don't know what else you wanted to see. There's like everything else, There's coming attractions. Watch the previews when you see what happens in New York and Florida. It's a pandemic. You're going to have it too. Don't get too excited
California
about
and
not having it at
Texas
the moment.
and Pennsylvania and New Jersey and Ohio.
Yeah.
And all the places that report, with half the cases not reporting yesterday. There were only 16 states that reported new cases of COVID yesterday on Worldometers.
Usually the case. About 16 on a Sunday, maybe 20, 21 on a Saturday. And if you're looking backwards 2 weeks, nobody on New Year's or Christmas, or practically nobody. It was down to like 8. States just stopped. And I guess you have to give your permission to people to take a weekend off at some point. The pandemic's been going on for 2 years, but it's been a long time since a majority of the states bothered reporting on a weekend.
Right. So it's Monday, and we'll have to take a look and see what's going on here. And probably, if you start collecting the data on Monday, you don't really hear it till Tuesday.
Right.
But we'll see what happens. New York State does a pretty good job of data collection, so we'll be keeping an eye on that through their Department of Health.
They stay open all weekend.
Yeah, and we'll see whether the peak really is peak and so on and so forth. But with that, here's some practical advice. Wear a high-quality mask. If you're thinking about using rapid tests as part of your personal plan, then order early, because you can't just go out and get them. It's not that easy. Everybody knows, I'm trying to find a test. Where do I go? What people don't say is, well, I have one because I bought it 2 weeks ago because I anticipated that this was going to happen.
Yes, well, we say that.
We say that, so I'm just doing this as a public service.
Yeah, well, everybody should do that. Can you? We'll have to work on it after the show at some point, getting you to say, "Oh my effing God, order an effing home test already, and then we'll have it set, and we can do the same thing that we do with the vaccine."
Well, I can only do that if it actually says it on the headline. So I'm just reading it. I'm not really saying.
I'll bleep you. It's okay. Then you can do whatever you want. Okay. Well, yeah, very interesting. That, and also I ran into some anecdotes over the weekend of people taking tests at testing centers, and the testing centers running out of capacity to process the tests, and then emailing people and saying, your sample went bad, come back in for another test. That ain't so good either. All right, we'll continue with this discussion on Wednesday. Thanks, Greg. All right, welcome back now to the Kagro in the Morning Show here on Netroots Radio. Greg's working on his way back to Plumbing World and taking care of business there. We'll speak to him again on Wednesday. Short discussion during the break that I guess I will pass on the air. Credit to Greg on this one. He kept in the closing kept urging everybody, go ahead, get out there, order some more tests, stock up. Now, I've got some. He's got some. Maybe you've got some at home. And I said, well, I'm not ordering any more on Amazon because, well, for one thing, who cares? I don't want to wait 2 weeks to get them anyway. But I've got some in stock. And although you can never have too many, I guess, if this is going to go on for a while, especially if you're going to have to test yourself twice every time and do so fairly frequently and with 4 members of the family. But I feel bad like grabbing up more tests, even if I have to wait 2 weeks for them, when there's so many people who don't have any. But as he pointed out, if you have the organizational skills to go ahead and order some tests ahead of time, and you've got, thankfully, because you've prepared, you have the capacity to wait those 2 weeks, don't worry about it. When those tests show up, if they are not needed, if you don't need it, it doesn't mean you have to sit on them forever. Give them out to friends and neighbors who complain that I can't get one, or I waited too long, and I've been waiting 3 weeks for my tests and they haven't showed up. You can say, well, I've got some coming in the mail, I hope anyway, or we actually got them, and come on, I'll meet you if you want, masked and in the street outdoors, and I'll hand over some of the tests. Give them out when you can. So I think that's a pretty good idea too, and that's changed my mind about whether or not to go ahead and prepare any further out for this stuff. It may be that I never need the tests. It may be that I don't have enough friends in the world to think about who to give any to, or none who would complain to me anyway, but I'm sure we can come up with something. Anyway, I think that's a good thought, and it does change my mind about that, and whether we will, be able to get a hold of these things or not. All right, let's see. Moving on with some other items here that I had put away. I mentioned to you today that I guess I'll refer you to the thread, but something I mentioned early on. I mean, I don't know. It's not exactly an authoritative thread or anything, but just an interesting discussion among parents on Twitter talking to one another about their experience with the back to school situation, and various parents from various locations around the country, and it's not easy to compare school districts one to the other, but interesting undercurrent, and I'll let you, take a look at it and judge how widespread you think the feeling is. But interesting, I guess, undercurrent. We keep talking about the undercurrent of trust in government, say, among the types who will listen to Fox News and or Trump, who will tell you constantly, don't trust government, and then they don't. Similarly, finding a lot of kids around the country, particularly around high school age, not being particularly confident in the decisions being made on their behalf about their health in sending them back to school. A lot of parents sharing sentiments that kids have, then, the parents could be wrong, the kids could be wrong, or the kids could be right, that they don't, at least we know what they're feeling. They feel like they're being sent back to school as a political matter. And that's a pretty remarkable realization to have to come to when you're 14, 15, 16 years old, that you're a political pawn in some kind of a game. And it's possible that you've read the news for the past 2 years, you're aware of what's going on, and you stayed home from school a year ago and took your classes online, and everybody's busy talking about how detrimental that was, both to your learning and your learning retention and your mental health and your social abilities, etc., etc. And maybe you agree with all of that, but you still find out that it was all for naught, and that nobody really particularly cares a great deal about what's best for your physical health, even if there are risks to mental health, because now they're just going to risk both. And now we're going to have kids both physically ill and suffering the mental stresses of finding out that the adults who were supposed to look out for them decided to stop, and decided that it would be very difficult to get reelected, for instance, if they did what was right for you. And even if that's not the case, raising a generation of kids who believe that to be the case, that poses a certain danger as well. Anywho, I also mentioned at the top of the show that we're having a particular problem in one of the neighboring counties, right? Did I put this story away? Yeah, all right. I grabbed the WTOP story that we got from our production crew in the background, having read this at dinner last night. I put it aside because you probably also saw at some point over the weekend that, I don't know. I'm not certain who this particular person is, but she pops up every once in a while as one of these annoying right-wing influencer, mommy blogger types, and I still am just unclear about who the person is exactly. I mean, they have a Twitter profile and they explain themselves, but that doesn't help. You know what I mean? Let me see if I can scroll back and find it. It's Bethany Mandel. She's got a blue check mark, so she's a person of some importance to somebody, but I just don't know who. Anyway, and this is her shtick, as she frequently throws these kind of counterintuitive, hissy fits about things, and who knows what. Anyway, here's what it says in her Twitter bio. I mean, it gives you an idea of who you're dealing with when the first thing that they say is, wife of Seth Mandel, Seth A. Mandel, and it's connected here, and I don't know who that is either, but let's see. Washington Examiner. Okay, now I know who that is. Seth himself describes himself this way: father of the 5 Irishest Jewish kids on earth, executive editor of the Washington Examiner magazine, previously the New York Post, Commentary magazine, and then pointing to Bethany, who tweets as Bethany, I don't know how you pronounce it, Shondark, Shondark. I don't know if that's the surname, maiden name as they used to call it back in the day when you said such gendered things and didn't feel terrible about it, and or maybe it's a nickname or a conglomeration of, who knows. I don't know who she is. I don't know where she came from. I don't know who Seth Mandel is. It doesn't matter. They're just sort of annoying weirdo people, and this is what they were being annoying and weirdo about yesterday, which was, and I've already skipped away from it. Let me see if I can back up to it. Anyway, she tweeted around a copy, for some reason, screen grab of her angry email to local politicians in Montgomery County, Maryland, which is where she's living, and talking about how terrible they are for trying to take precautions about COVID. You know, that's essentially where she's coming from. Now, I'm going to have to start all over on this thing, I think. Here we go. So she advertises, to no one in particular, that this is my email to, and let's say names 1, 2, 3, 4, I don't know, a handful of people on, I think, the Montgomery County Council, including, this is interesting, the first person being Mark Elrich. And she addresses the crowd this way. I mean, this is kind of a rude intro, I guess, for an email. Hi, Elric and members of the council. So if his last name is Elric, hi, Elric. Okay. Maybe hi, Mark. Hi, Mr. Elric. Hi, Councilman Elric. Nothing. Hi, Eric and members of the council. So here's the everybody listen to me email. I know you've been deluged by emails from residents about the proposed vaccine passports. That's the issue at hand. Vaccine passports in Montgomery County, Maryland, which, to be fair, Greg mentions in the context of Omicron might not mean a great deal. Maybe the vaccine passports aren't a particularly good idea, which is a great excuse to not do them if you feel, let's say, threatened by Bethany Mandel for some reason. Anyway, I know you've been deluged by emails from residents about the proposed vaccine passports. I've seen a dozen of them, ranging from scientists to parents to business owners. But you haven't heard from Bethany Shondell yet, so listen up, and I'm sure everybody's going to feel that way. Mark Elrich, by the way, or Elric, is the Montgomery County executive, as opposed to a member of the county council, which is also, co-governing body. It's a weird structure, county executive. He's not exactly, executive only, but anyway, it doesn't matter. County official. Anyway, so she goes on and says, I'm writing you today with a warning about what these passports will do to you as politicians. They will end you. I will guarantee that. Now, how does she guarantee that? She guarantees that by being the wife of Seth Mandel, first and foremost, apparently, a homeschool mom to 5 children, and an editor at Ricochet, whatever Ricochet is. Ricochet, apparently, as it turns out, if you scroll over, it is a conservative conversation and community and podcasts. Get your first month for free, which they call Coolidge level. So I guess they name them after Republican presidents or idiots. I'm not certain which. Or silent people. That could be it too. But she's an editor at Ricochet, also a contributing writer at Deseret News, and editor of Heroes of Liberty. Yeah, Heroes of Liberty. Those really super popular publications. Anyway, that only comes up because in the context of her letter, it makes a certain amount of sense. So that's who she is. She's Seth Mandel's wife, a homeschool mom, and editor or contributor to 3 online things that, Deseret News is an actual thing anyway. But I guess so. They probably throw her $50 a month to give us we need some crazy conservative columns every once in a while. Would you give us one? you be one of the 15 people in the stable that we pay $50 a month to give me your blather. Sure, yeah, no problem. The other two, made up. I mean, no more or less made up than the Kagro in the Morning Show, I guess. But, at any rate. She's writing you today, of course, to warn you that doing this will end you. I will guarantee that, because I'm in a position to guarantee things. Few residents of Moco, Montgomery County, know your names. She's speaking from experience. Very few people know her name. If you pass this and inconvenience residents, oh my God, inconveniencing them, inconvenience residents and deliver a death knell to restaurants and gyms, that will change overnight. What a collection of death knells we're talking about. Not only the restaurant death knell, but also gyms. By the way, these are the things that are important to me, and I really don't give a crap one way or the other about things that are important to other people, which is, that was going to be the premise of an anti-vaccine passport letter anyway. But okay, so that's her thing in life. Homeschooling 5 kids, restaurants and gyms. The primary, where your electoral fates are decided, are at the end of June. An election timed in this way is going to have rock-bottom turnout. The only folks who will turn out will be those who are energized. Guess who that is? By the way, we're talking about a Republican person speaking authoritatively about guaranteeing the outcome of a Democratic primary. But okay, she's pretty sure everybody's on her side because, after all, she is. So there you go. 100% of people surveyed agree. I plan to end your careers if this passes. You'll actually have to get real jobs. I mean, let's get real. You'll just become lobbyists. But do you really want that to happen? Well, it wouldn't be the worst thing in the world. It probably pays a lot better. And by the way, I would guess not a whole lot of county council people just go on to become lobbyists. They could be, lobbyists at the county level. They could be national level lobbyists too. I mean, we're right here in D.C. That's certainly true. It's more likely to happen, I guess, in the Montgomery County Council than, Omaha, I suppose. But, there's lobbyists at the local level too. And it's fairly, well-to-do county, close in, and has a pretty substantial tax base. There's a lot of money trading hands. Anyway, do you really want that to happen? Apparently they don't. Vote wisely if you bring this up to a vote. And if you do, I'll be there again. I'm not really certain what that means. I guess that means she'll show up at the meeting and complain about things. But anyway, look out. She will end your careers in between, by the way, homeschooling the 5 kids and editing Ricochet and contributing to the Deseret News and editing Heroes of Liberty. But apparently that leaves her enough time to guarantee that your career will end. And then you'll have to get real jobs, like presumably editing Ricochet or editing the Heroes of Liberty. It's just difficult to take somebody seriously when they, are lecturing others about the need to get real jobs from behind the editor's desk at Heroes of Liberty. I love subscribing to Heroes of Liberty. Anyway, we don't know who she is. I mean, she's considerably more famous I think she's most famous for people in my Twitter feed retweeting her tweets and saying, what an idiot. I think we hate this person. But anyway, I just thought that was kind of interesting. So, but all of this happens she's very proud of herself. She's showing everybody this letter. At the same time, we're reading Montgomery County schools report 10,000 COVID-19 cases ahead of policy change. Ivy Lyons reporting this piece for WTOP News, the local all-news radio station around here. Montgomery County, Maryland, public schools reported more than 10,000 COVID-19 cases ahead of the first classes of 2022. Ahead of them. Montgomery County Public Schools said that all but 11 of their schools remained in person, nonetheless, though 126 schools have since crested above the county's red COVID-19 designation. That's what we were discussing at the top of the show, that the schools, right in the beginning of the pandemic, everybody came up with all of these very impressive looking status statements of we are going to close if we have X amount of community positivity or community transmission, et cetera, et cetera. And very soon it became obvious that we were either always going to be flirting with or surpassing those kinds of levels. And they said, to hell with it, we're just not going to deal, except for the year that they closed and did remote learning. That, I guess, but once they reopened, and even when they were discussing reopening, or when here in Loudoun County they moved to hybrid attendance pretty early on. They didn't have a full year class. Our son stayed home for the full school year, but they gave you the option of returning about halfway through the 2021, I don't know, what was it, 2021 school year, and people did. And you know that because, of course, Loudoun County schools got in the news nationally when they complained about what they were doing with discipline cases when the kids were back in school. And so, yes, absolutely, the whole thing was crazy that they were pointing to. Virginia is the tip of the spear. Everybody's going to be realigning as Republicans because they were tired of schools being closed. Like right here in Loudoun County, schools were closed for a year, and also were angry about this discipline case that took place in 2 schools in this county, which were totally closed. Oh, yeah, they weren't. But anyway, the point is, okay. Well, anyway, up in Montgomery County, they don't know what to do because having 10,000 cases before you return for class is clearly going to surpass all the levels that you said were going to trigger closures, but you're afraid to close. So they just are blowing right past it. As I knew they would, I think we said so early on in the pandemic, and I think the comparison even then was to the school districts in gun nut parts of the world where they said dumb things like, we should allow teachers to carry their guns in class because they will totally be able to shoot school shooters before they get anybody, and they won't hit any students or anything. We had a big argument about whether that was going to work or not. But, of course, in selling the plan locally, even where people are into the guns, they had to tell parents, well, here's what we're going to do. First of all, everybody knows that if you're into guns and cool tactical stuff, then the element of surprise is the most important super cool tactical sounding Delta Force SEAL Team 6 tactic that you have. So we are going to mandate that nobody know which of our teachers carries the weapons. The kids shouldn't know, certainly, and we don't want the bad guys to know, and we don't even want anybody else to know because people who own guns are very scared that if the government finds out that they own guns, even though they're working for the government carrying the guns, if the government finds out you have guns, then they'll come and take them from you, even though we just said you should take them with you wherever you go, even school, but somehow also imminent danger of them being grabbed away from you, plus your Bibles, obviously, and then they'll, kidnap your kids and move them to Jonestown. All the things that government typically does. Anyway, the point was that you were supposed to keep it quiet, whether you had the gun or not, and keep it private, and also so as not to panic the children. Never, 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 ever, ever, ever let them see the gun. And, you don't want that for various reasons. And also, of course, never, ever, ever, which should go without saying, let it out of your possession or out of your control. Don't put it on the desk when you leave to go to lunch or to the bathroom, or for that matter, even though some of you might have come to believe that that was the safe thing to do of going to the bathroom. Leave the gun behind because you'll just shoot yourself trying to take it off and put it back on again. Happens all the time in the bathrooms. But don't leave it there with the kids either. Everybody, pay attention to your test. No looking at your neighbor's paper. I'm going to leave for a few minutes. You're on the honor system. I'm putting a gun on the desk, and I'll see you later. Don't do that. Anyway, we knew right away that they were never going to enforce anything like that, and indeed they didn't. And one of the early stupid stories that came to light very quickly, a bathroom story, a story of the public school teacher in Utah who said, yes, I will carry one of these guns that they allow me to carry, and sure, I'll comply with all the rules, and totally never let the kids know I have a gun. And then she shot herself in the bathroom, or she shot the toilet and exploded the toilet and took porcelain shrapnel. I mean, that's even worse in terms of embarrassment, I think, than actually shooting yourself. But anyway, But yeah, they interviewed the kids there and the parents there, and they were like, oh yeah, all the kids knew she had a gun. It would stick out from her sweater all the time. She was constantly trying to cover it back up and yada yada. And everybody was like, it was no big deal. Well, we've all got guns. We've all been raised around guns. We're not made nervous by guns. Okay, that's as may be, but your rules said that the teachers must never let the kids see the gun. And, or else what? And there really was an or else. The or else was, or else you're out of the program and you're not one of the people permitted to carry guns in the classroom anymore. But no gun nut is ever going to enforce the, okay, someone has crossed the line and they're not allowed to have the guns anymore, because that would be contrary to the narrative that they want and the story that they want and the thing that they think makes people safe. Yes, they were violating all the safety rules, but still you're safer even with a person who's violating safety rules, but who could shoot a classroom, a school shooter, than you would be with somebody who wants to shoot a school shooter, but can't because they can't handle a gun safely. Again, not thinking about what happens during all the time while you're waiting for a school shooter to show up. If there's guns idling around in the hands or on the hips of people who are terrible at gun safety, then you will have problems. And then people say, what problems are you going to have? And you start talking about the various accidents you can have. Oh, but that's garbage. That'll never happen. Then she actually shot herself. And still they were like, yeah, but, that could happen to anybody. And besides, technically, she didn't shoot herself. She shot the toilet. The toilet is the one that shot her. Get rid of the toilets. So, then you had that debate. Well, similarly, you were going to have this. Well, nobody wants the schools to be closed forever, but if we get below this threshold, we can open them up. But, well, what about if there's more disease after? That's bad news. We don't want that to happen. What happens to our kids? Sure, you go down to 3% positivity and you open back up. And I think it was even lower than that. They were setting the levels. What if it goes back up to 5, 10, 15% positivity? Are we going to close then? All right, yes. At 10% positivity in the community. We'll never get to that. Then we'll close again. And now we're at 20% positivity in places. And they're like, well, 10 is a lot like 20. So here we are, Montgomery County, 10,000. I don't know what their deal is, but 10,000, I don't know what the rules are for them. 10,000 cases. We'll go on here. So now they've crested above the red COVID-19 designation. Red usually means what? Stop, close, something terrible is happening. Well, how about if we pay no attention and open anyway? Well, we could do that. Bethany, Shondell says we should do that. And she says she'll end our careers from home if we don't do it. The rest of the story reads, the system tracks schools with red, yellow, and green indicators across 14 days. Since December 23rd, all but 4 schools in the district were in the yellow or red range, but nothing comes of it. Montgomery County Education Association President Jennifer Martin said that COVID-19 continues to disrupt education, but acknowledged that minority groups were most severely impacted by these challenges. But the pandemic has hit students from vulnerable and systematically neglected populations hardest, widening the opportunity gaps by limiting access to crucial resources and supports, Martin wrote in a statement. All true, and all good reason to consider doing something different. True. Reaction varied as Maryland's largest school system navigated shifting from a formula for transitions to virtual learning to a case-by-case system. In other words, they set out standards, and then they met those standards for closing, the standards you don't want to meet, and then they said, why don't we try something different, like different standards or no standards, or on a case-by-case basis, we will forget what the standards were and go ahead. A petition to the Board of Education also underlined the severe impact that a return to the classroom has had on some groups. The petition, which approached 10,000 signatures, almost as many people as actually have COVID at the moment, as of Sunday morning, will be brought up by the current student member of the Board of Education, Hannah O'Looney, on January 13th. And it's an unfortunate bit of a last name there. And I hope nobody makes fun of her to her face about that. I mean, honestly, I guess you could say I just did, but I mean, I think that there are parents who will stand there and actually say, your name is Looney and how dare you? And that would be rude, and I would probably not try that in an actual meeting situation. This is a huge step for us as a community, petition author Zoe Cantor wrote in an update. I never would have thought this small petition I made out of frustration in our county would have gotten us this far. And I'm not even clear on what the actual petition is, but maybe we'll figure that out during the break and find out. However, some parents and advocates for keeping area schools open in person, okay, she's for closure, I guess, maintained that recently changed policies shifting schools to virtual learning were arbitrary unless the impact of COVID-19 on operations was widespread. I think it's a huge mistake for our if our county pushes over 60% of the schools within the district to virtual education. Jennifer Reisman, who heads a parent group that advocates for keeping schools open, told WTOP's news partners at NBC Washington. Bethany Shondel, of course, homeschools.
Hi, I'm Scott Anderson, the guy that writes the daily summary for this show, Kagro in the Morning. Thank you to everyone that supports this show. Many of you send donations through PayPal, Patreon, Square Cash, Radio Public, and so on. Some of you write your own essays and send them in, or read articles with your own commentary. We appreciate it. Now, some of you are listening to this and thinking, I'd like to help, but isn't there something I could do that wouldn't require money or effort? Why, yes, there is. You can just like us. On Daily Kos, they call it the recommend button. YouTube has a thumbs up. There are hearts and likes and love buttons. Tap our love button. Tap our love button every day. Share our shows and summaries on Facebook and Twitter, YouTube and iTunes, Stitcher and Amazon. Most of these places allow you to write a review, so a sentence or two would be great. Recommend us to social media, or tell your friends to listen to the show. You aren't just helping us, you're helping them find their new favorite thing to listen to. You could change the world. So thank you in advance from me and everybody else in the world.
All right, welcome back now to the Kagro in the Morning Show here on Netroots Radio. Thumbing through my own Twitter feed once again. I find myself thumbing once again. Looking for some tweets to follow this up with. But I guess we are almost at the end of the Montgomery County story. In fact, yeah, there's just one or two short sentences left. So competing interests here, the petitions to close the schools if necessary versus the petitions to keep them open at all costs. This article ends this way. However, one student said they didn't understand the point of attending classes and that the schools were empty due to the rapid increase in positive tests. So it's like, what's the point of being there if it's going to be like barely any teachers, not enough subs, and students aren't even coming, a Paint Branch High School senior said. Yes, well, not perhaps the best expression of it, but understood in context of other students elsewhere who have expressed things either better or more fully. Nothing wrong with this. This makes the point correctly, but that's what's interesting. This is the lived experience of the students here. And while you could always expect a certain number of students to say, what's the point of going to school? It's all stupid and I don't learn anything anyway. And you might not be able to trust their judgment in this and they just don't want to go, or they want to sleep late or whatever. But they're making a good point here, made at length by students at schools elsewhere suffering from similar problems, and and teachers who are saying much the same thing. The reality of what's happening is, well, it's the manifestation of what we have predicted for a long time, or what we've said for a long time here on the show and out on Twitter. You say you're open, the virus says otherwise. We can say you're open all you want, but if the bulk of your teaching force is not there, or half the students or more aren't there, are you open or are you not open? Well, so for the sake of the politicians, say, I did it, I succeeded, I kept the schools open. I made the problem worse, but I kept the school open. And what problem did you make worse? Not only the pandemic, which caught up with more people and sickened more people or cost more people more productivity time, but you also made the schooling issues worse. Why? Because of reports like this one and others that I could share with you from the Twitter world, which say, think through what the real logistics of dealing with a so-called open school in the middle of a huge spike of Omicron variant really means. There's all sorts of variants on this, like, for instance, let's see, I'll scroll back a little ways. Our good friend Steve Singeiser, who's a teacher himself in California, describing essentially what's going on there and how, and this is, I guess, here's the mild case of it. It's the Omicron version of what's happening in schools. I'll give you the Delta version later on if I can scroll all the way down. But Steve was just saying, you show up at school and 50% of your class is absent, and some percentage of the kids who were there are in fact symptomatic and positive, and you can't tell them to leave for whatever reason. It's, against the rules. And then you start trying to figure out, all right, well, what am I going to do here? I could go ahead with my lesson, but if 50% of the class is absent and we can't, and these kids are not going to get the lesson, what do I do? These kids will never make up the time. Do I slow things down so that I wait for the return of the bulk of the kids? There's always absences that you have to deal with, and you can do your best to try and make up the difference for one or two kids who were absent during a crucial part, if it's partially their responsibility to come forward and, do the makeup work and all that. But if it's 50% of the class, you got a real strategic decision to make. Does it make more sense to go ahead and try to bring 50% of the class up to speed later on? Or does it make more sense to slow things down so that, and to wait for more of the kids to come back? And will they come back? And by the time your 50% that are out come back, the other 50% are out. And then you got to wait through another. And then who knows whether you're going to get sick during the middle of any of this. It's really impossible to figure out, what the best thing to do here is. At the same time, you've got, students with similar complaints. Oh, and let's see, also in many school districts around the country. For instance, here we have our good friend Charles Gaba, who points out a note through, Twitter or social media of some kind that they got from the school administrators where he lives, just letting everybody know, generally, like is happening around the country. Hello, our building administrators shared out some additional mitigation strategies, and our dashboard will be going through some minor changes to make it easier to read. Also, casually thrown in there, if you know of anyone who's interested in being a sub, please have them contact me. We are at the point where they're basically calling on parents, or in some cases, in some communities, anyone over 18 who would be willing to do this. Just come and be a substitute teacher. And I wonder how much success they're having with that. And I do wonder about how frequently, you have parents screaming about open to schools, and then the schools say, well, we need subs because all the regular teachers are out sick, from the hoax that you don't believe in. That's why you want the schools open. So can you fill in? Look around here, kick the dirt a little bit. Gee whiz, I don't know. I'm kind of busy. What are you busy doing? Oh, I'm busy writing angry letters to the editor about how they need to open the schools. And so where are all the people who, by the way, were prepared to chuck it all, and I'm going to run for school board and have all these incompetents fired, and I'll guarantee to end their careers, et cetera, et cetera. Where are you? Are you teaching in the schools? Well, Bethany's not, because she homeschools. She is teaching. She's just not teaching anybody else. That's the way the homeschool gig goes. I can understand that. You're busy. But anyway, I'm wondering whether the people who said that they were prepared to chuck it all and take on the enormous time suck of being on the school board, how come they're not in there teaching? I ain't seen it happening yet. By the way, also out there, let's see, Scott Charles, who we talk to all the time about gun issues, happens to have noticed the same issue on COVID. Down in Texas, he's not from Texas, but he happened to notice Greg Abbott tweeting 37 days apart, as he notes here for the record. Let me open this one up so I can mark it for inclusion in Pocket, but 37 days apart between these two tweets. One, great news, my executive order banning mask mandates by government entities is now law. The Fifth Circuit Court of Appeals has granted Texas's motion to stay a lower judge's ruling, thanks to Ken Paxton, the Attorney General there in Texas. That tweeted on December 1st, and 37 days later in January 7th, on January 7th of 2022, KUT News in Austin tweeting out, or is it KUT News, or it's KUT.org, and I don't know what KUT is. I thought it might be a TV station. Anyway, school districts are asking parents to fill in as substitute teachers as COVID cases rise in Central Texas. So, a little bit of cause and effect there, but it's 37 days apart, so that's too long for Republicans to be able to put two and two together. Let's see. Someone replying to Scott Charles about the substitute things here, saying, I guess, reprinting a screen grab of a message from their local system, or I guess, a meme about this phenomenon. Schools pivoting to anyone who is legally an adult is now eligible to be a substitute teacher suggests that perhaps the quality of the student experience is not really what in-person advocates are actually concerned about. Yeah, that does raise some questions all by itself. Let's see. There were some other things, though, that I thought might be of some interest. One of which, a widely circulated article from, I guess, taken from one of the Reddit boards. Let me see if I can find this one. But I think a kid who put up a Facebook post about what was going on in their New York high school, and then one or two notes about some other things also from elsewhere around the country. Let's see. Can I find this thing? There was a lot of activity that day. I just saw the one from somebody reacting to it. Maybe there we go. So widely circulated tweet from Adam J. Calhoun, who got lots and lots of retweets about this thing. Let's see. Currently at Princeton, a neuroecology at Princeton. Interesting field of study. Circulating this post from a New York City high schooler about the COVID situation right now and how wild it is. And I agree. Yeah, it looks like I guess it's on Reddit, and a screen grab from that. I am a New York City public high school student. The situation is beyond control. And let's see. When I saw this thing circulating on January 7th, too, so end of last week, writing, I'd like to preface this by stating that remote learning was absolutely detrimental to the mental health of myself, my friends, and my peers at school. Despite this, the present conditions within schools necessitates a temporary return to remote learning, if not because of public health, then because of learning loss. It's, in other words, worse with quote-unquote open schools. Here's how, in case you can't envision it. Let them tell the story and check it out. I mean, just see if this doesn't ring true to you. If you think back to your school days, wouldn't this be essentially likely how they would handle mass absences both among students and staff? Story of my day begins this way. I arrived at school and promptly went to study hall. I knew that some of my teachers would be absent because they had announced it on Google Classroom earlier in the day. And these kids get these communications. I see it's happening all the time, right? At our school, there is a board in front of the auditorium with the list of teachers and seating sections for students within study hall. In other words, you had study hall. It used to be scheduled. You would go to X room. That one teacher was assigned to supervise study hall, and as it turns out, they're absent today because illness. So you get to the school, there's a big whiteboard in the front that says which teachers are absent, and if you have this teacher for, in particular for study hall, go to the auditorium for study hall. We don't have enough teachers or substitutes to cover every one of these individual classes. Study hall's in the auditorium now, and if you're in this class, sit in this section of the auditorium. This class, sit in that section of the auditorium. Presumably to make it easier for them to take attendance later on, because they do take attendance. To what end, we don't know, but they want to take attendance, so they want the kids not just milling about in the auditorium. Plus, of course, keep people in line here. It's still students and mixing hundreds of them. Never a great idea, much less in the middle of a pandemic, but if you got to take attendance, okay, fine. So there's a board in front with the list of teachers and the seating sections for students within study hall. Today, there were 14 absent teachers for first period. There are 11 seatable sections within the auditorium. 3 classes had to sit together on the stage. That's how full the auditorium was. Filled all the seats. Now we got classes on the stage for seating. And how many of them? 3 of them crammed together on the stage. Study hall has become a super spreader event. I'll get into this in a moment. Our writer says, second period, I had another absent teacher. More of the same, like from first period. It was around this time that 25% of kids, including myself, realized that there were no rules being enforced outside of attendance at the start of the period, and that cutting class was ridiculously easy. Not only easy, but actually safer for you than sitting in the auditorium with all those kids. We left. There was functionally no learning occurring within study hall, and there really never is, and health conditions were safer outside of the auditorium. It was well beyond maximum capacity. Third period, I had a normal class period. Hooray! Like the teacher was actually there. First thing the teacher did was pass out COVID tests because we had all been in close contact to a COVID positive student in our class. Okay, so in third period, whatever class that was, all right, one of the kids is out today. He has COVID. That makes you all close contacts. So here are some COVID tests, kind of like what Greg suggested doing. I've got them. Maybe the school provided them. Maybe they bought them themselves. They're buying, teachers buy school supplies all the time. But at any rate, they had the COVID test. They said, here you go. You've been in close contact. Everybody's going to need to do a test. Take these things home. Test yourself later on. 4 more teachers would pass out COVID tests, by the way, during the day, and which they were to be taken at home. The school started running low on tests as a result. I guess they were getting them from the school. And the rules had to be refined to rationing. They told the teachers, all right, stop just handing them out to everybody, because we're running low on tests. Now, what does this mean? Well, you're handing out these tests to a bunch of high schoolers, right? And the test, you've all been in close contact. You're all going to need to take a test. Take them home and take the test there. Yeah, right. That's what he writes. To be taken at home. Yeah, students don't listen. 90% of the bathrooms were full of students swabbing their noses and taking their tests. I had one kid ask me, with his mask down, by the way, whether a faint line was positive. Now, all over the instructions for these things, from the one I took, they're like, yes, absolutely, a faint line is a positive. And you should see this great instructions. They included a couple of pictures of very, very, very faint lines and said, even this right here, if it's like this, that's a positive test. I don't know if all such tests did such a great job of showing it in the pictures, but it's very hard to believe. And it's intuitively you want to believe, well, maybe this is a mild case. I heard this is mild, a very light line must be in a very mild case. It doesn't. It just has to do with the sensitivity of the chemical reaction in the test or whatever. But they're just saying, look, if there's any line, you are positive. So here comes the kid with the face mask down. Is a faint line a positive? You mean like the faint line you have? Yes. I told him, go to the nurse. One student tested positive in the auditorium, right, where they've stored all the kids, and a few students started screaming and ran away from him. Just imagine doing this to the kids. I know they're high school kids. They're better than kindergartners, but take these tests at home. All right, no, we're going to take them right here. And then, of course, you take it right there in ew, gross, he's going to stick the thing up his nose. All right, well, wait 15 minutes. What happened? Oh, my God, he's positive. He's positive. They're running away. Now they totally lose control of the auditorium. And, of course, everybody else is like, now I've been in close contact with that positive kid. I got to take my test. If I'm not going to do it here in the auditorium, I'm going to go to the bathroom and do it. chain reaction, total disaster, and a good idea to hand out the tests, right, for free. Take them home and do them. But these are kids. These are kids. So there you go. You got the positive right there in the auditorium. People are screaming and running away from him. There was now a lack of available seats given that there was a COVID positive student within the middle of the auditorium. They're now planning on having teachers give up their free periods to act as substitute teachers because the auditorium is simply not safe enough. They want to disperse the kids back to classrooms, and teachers who have periods off in between class no longer have periods off in between class. So that ain't going to go very well. Classes that I did attend were quiet and empty. Students are staying home because of the risk of COVID without testing positive, as they should, and some of my classes had 10 plus students absent. Nearly every class has listed myself and others as close contacts. So he's a close contact from, 10 classes, so he's almost certainly eventually going to test positive. I should note that in study hall with subs, we literally learn nothing. I spent about 3 hours sitting around today doing nothing. I tested positive for COVID on December the 14th. At the time, there were a total of 6 cases. By the end of the break, this number was up to 36. By January the 3rd, when we returned from break, the numbers were up to 100, as listed on the Google sheet, the school Google sheet. Today, there are 226. This is around 10% of my school. As of Monday, only 30 of whom were reported to the Department of Education, which seems like negligence to me. Let's see, I have to skip over to another screen grab here. 90% of the conversations spoken by students concern COVID. It has completely taken over any function of daily school life. One teacher flat out left his class 5 minutes into the lesson and didn't return because he was developing symptoms and didn't believe it was safe to spread to his class. So just walking out. All right. I've been adamantly opposed to remote learning for a while and thought that it was an unmitigated disaster for the learning and mental health of students. At the present time, however, schools cannot teach and function well enough in person. We must go remote. I should note that I wrote this on Wednesday, I guess, of last week. And then there's an edit removing the names of the school because he didn't want all sorts of people mobbing the place. But basically, does that not describe every high school you've ever been to or had any experience with? That's exactly what would be happening. And voila, it is exactly what is happening, to no one's surprise. Let's see. There was another one similar recently. I got to scroll back up, and I think it was a lot further than I thought. But somebody else saying similar experience, not in New York City and not in high school, but in middle school. There we go. We got this one tweeted around by Lincoln Michael, who I also don't know, but who's a Substacker and has got a blue check mark. So there you go. And he found someone else's Facebook or whatever the hell post here. I am not in New York City, but here's a picture of what's going on in the middle school I teach in. Okay, a teacher. I don't know the overall numbers, but 6 out of my 31 students in my homeroom are at home with positive cases. Now, 2 out of the 31 of the students have tested positive and are in school today. I, the teacher, have a fever under 100, but also a vicious cough and have tested positive on an antigen test. I am positive, right? Watch this. However, I'm out of sick days, and I'm required to keep teaching until I test positive on a PCR test. I took one of the home antigen tests, right, and found out that I'm positive. But no, the rule is, because the mean, terrible teachers unions just dictate everything and dictate terms wherever they go, except this one, apparently. Oh, and pretty much everything else. The school rule is you got to keep teaching until you test positive on a PCR test. So I took a PCR test last Thursday, and this is one of the anecdotes I told you about earlier today about testing capacity. I just got an email saying they didn't get to it. and the sample is now too old and I need to make another appointment. Well, the fastest appointment I can make is January 14th. This was from January 7th, so a week later. So in other words, got to keep teaching for an additional week, even though you know you're positive from the at-home antigen test and you're having symptoms. In fact, you have a fever. But the school rule, keep teaching. So fastest appointment I can get is for January 14th. I get 1 free period per day to plan and grade. That's your free time, is you're planning your lessons and grading homework, etc. for the classes you've already taught. But remember, over in New York City, no free period for you anymore. You're back on no planning, no grading. Do that at home. You got to go supervise more COVID positive kids, or probably COVID positive kids, who are swabbing themselves right in front of you. I get 1 free period a day to plan and grade. I'm covering during that period. I have 30 desks and have combined 2.5 classes into these 30 desks. There are currently 62 students in my room. Super spreader event anywhere else. We tried to take the overflow and put them in the cafeteria in the halls, but fights broke out. I, by the way, am at a charter school. Yes, right. So the public school is probably not quite so bad about you have to teach until you get a positive PCR test, maybe because there are, in fact, unions there. Whereas the union-free charter schools, this is the rule you get handed. You got to keep teaching even if you're sick, unless you can prove it with a PCR test, which no one can actually administer for you for the next 2 weeks. So there you are. I'm in a charter school, have no union, and cannot leave because I'm scared to lose a job that in normal circumstances I love. Then an extra edit here at the end. Roughly 1/4 of the staff is out with COVID right now. The district dashboard, though, because remember, charter school, the district dashboard says we have 0 cases. 0 cases. 1/4 of the staff is out. They know that even in homeroom alone, I have 8 kids who are positive. Only 6 of whom are actually home today. The other 2 are right here giving the rest of us COVID. Why? The dashboard says we have 0 cases. This is because the charter school, only report cases if we can conclusively prove, they're into the proof here, that a case was contracted in the building, because it's a totally different virus if you get it somewhere else. It's not dangerous if you contracted it somewhere else. Contracted in the building, fine. But no one can prove it, so 0 cases. Only a registered school nurse can make this determination. Here's another. This is a great process example, right? And like when we talk about the right to vote and access to the vote and counting the votes and what gets defined as a vote, all that stuff, check out this system, right? The dashboard says we have 0 cases. This is because we only report cases if we can conclusively prove that the case was contracted in the building. Already a ridiculous standard. Now, there's a rule about how to conclusively prove that a case was contracted in a building. And the rule is it's a ruling, a determination that can only be made by the school nurse. Right? Okay, fine. Let's go to the nurse and get her to determine that this was contracted. We have the proof. Let's say I have the proof. I've lived in the school building for 20 weeks. The only way I could have contracted this is inside the school building. I've never left. Nurse, what do you think? Oh, wait. This school doesn't actually have a nurse. Well, then I guess we can't make that determination. That's what's written here. Not only can you not leave, you not stop teaching until you get a positive PCR test, and not only does it require that the school nurse determine that you got the case inside the school building in order to count for your dashboard, but we've gone further and eliminated the nurse. So there's literally, and not changed the rules, there's literally no one in the school system empowered to make the determination that that dashboard should go even from 0 to 1, even though you have 8 positive students out of 31 in your homeroom class. Awesome job, charter schools. Well done. I'm sure it's a lot better there because, as you know, the government can't do anything right. And by the way, what happens at these charter schools? What makes the charter? Who sets the charter? Who runs the charter? Who determines whether the charter is being followed? Parents. parents do, because parents just want to have a say in their kids' education. And in those schools where they have a say in their kids' education, at least in this one, they set it up so that it was impossible, literally impossible, for them to get an accurate determination of how many kids are positive in that school. They don't want to know. Parents just want to have a say in erasing COVID positivity because they apparently don't care about whether the kids are safe in the schools that they have them attend. You'd think that would be counterintuitive, but apparently not. Well, anyway, there you have it. Very strange. I'll have to dig up Steve Singeiser's own narrative of what's happening in his experience in California schools. And we didn't even get to all the fun things that we discovered over the weekend about just how close we came to losing our democracy in the Trump coup, but there's plenty of time to get those things in under the wire. We got tomorrow. We got Joan McCarter coming tomorrow. I know she'll be interested in things like that. And I guess we draw near, I guess it's about a week until the 17th comes around, which is apparently, allegedly, the deadline for Chuck Schumer to move forward with at least the first attempt at changing the filibuster rules. So you know we're going to want to talk about that. All right. Wow. We covered a lot of ground inside the schools today, but much more happening around the country and around the world. But hey, that's what Justice Putnam is all about. He comes up with the West Coast Cookbook and Speakeasy next, right after this. And I'll tell you, we'll see what we can cram in before our music ends after this brief announcement.
From networksradio.com, you have been listening to Kagro in the Morning with David Waldman.
This sounds like a good idea. Hey, Darwin, listen to this. The Navy is adding 2 weeks to boot camp to sharpen focus on character issues. That sounds like a good idea, actually. And a federal grand jury indicted a New Orleans judge on tax fraud charges tied to wedding fees. Boy, these guys will take their grip any way they can find it. Stay tuned for that and more next.